So a second video here this week is on back pain. So it's stated that about 80 to 90% of people in the United States will have back pain at some point in their life. Usually in 4 to 6 weeks, pain goes away. Some people take their medicine, some people just do rest, the whole heat, ice. They do different exercises that they read on the internet. That stuff can work, sometimes it just goes away. But if you want something that's very solid that will work for your back pain, again, I'm going to refer to the anatomy to give a quick background. The back is up here, or what we call the lumbar spine or lower back. It consists of 5 bones that basically stack on top of each other. That's what we blame, but technically what we should be looking at is, once again, the pelvis and hips on a person. So if my pelvis and hips aren't moving, it's kind of like having a faulty foundation to your house. So you can have a good looking house, but if your foundation stinks, it's just going to make the lower spine eventually crumble, or in this case have a lot of pain and pinching. So what we find, we always want to address what we call from the bottom up. So we're going to take the hips and pelvis, and a quick 2 things you can try in a safe and pain-free way are to stand in a comfortable stance, slight bend in the knees. We want to brace the abdominal muscles so you have a tight but mild contraction through the abdominals, almost as if someone's going to whack you on the stomach. You want to tighten up a little bit, and then simply take your hips and move them side to side. You can have your hands on your hips if you want, or at the side. You do that about 10 times each way, a few times a day. And then the other one, twisting is usually thought of as bad. It's not. It's how you twist and rotate. If I get it mostly from my hips and pelvis region, my spine is very stable because I have a little bit of a contraction through my abdominals. And there again, I'm just going to do about 10 reps each side. Loosen up the hips, then walk or kind of test yourself to see if that makes your back feel better. It should be less tight and less painful in time. If you have any questions or comments, please email me, stop by, or call. Thank you.